2020's been a tough year for all of us, as we've done all sorts of mitigation efforts with our families and our community to try and mitigate the risk from this pandemic. We want you to know Health First is here to take care of you, your family, your friends, now and always. Before we get started, we'd like to share a little bit of background on each other. So I'm from Topeka, Kansas, went to college in my hometown, went off to Washington, D.C. to medical school, and joined the Army as an Army doctor. Did my residency actually in Hawaii and went around the world with the Army, and then settled back down in the Midwest for my medical practice until moving here 18 years ago, and I've been with Health First ever since. I practice family medicine, take care of all ages, and love it here on the Space Coast, and love practicing at Health First and taking care of our brave men and women in the Air Force, NASA, our engineering firms in the area, and just all the wonderful people of the Space Coast. Dr. George, would you like to say a few words about yourself?
Sure. So I'm Dr. Jayde George. I am a family medicine practitioner here at Health First Medical Group, and I'm our, like Dr. Laird was saying, our medical director for virtual health for Health First Medical Group. And in stark contrast to Dr. Laird's traveling history, I am actually from Central Florida, from Brevard County, and have spent most of my time here in Central Florida between growing up, doing my training, which I did down at Nova Southeastern University in Fort Lauderdale, and then went to residency over in Orlando, and then came back home to start working here. And I've been with Health First Medical Group for about 5.5 years now. So I am a local person.
Very good. Well, you know, during this pandemic, virtual visits have become very popular, a popular way to get health care. Dr. George, can you tell us a little bit more about virtual visits and the advantages and how that actually happens?
Yeah, so prior to the pandemic, we started looking into and launching performing virtual visits. And unfortunately, whenever COVID-19 really started to peak, you know, we had thankfully already had this tool that we had started to use. So in the month of March, we started off doing about 20 to 30 visits per week. And by middle of April, we were doing anywhere from 1,000 to 1,500 virtual visits per week. So it has remained a really valuable tool now that patients are able to come back into the offices, but providers really enjoy doing them, patients really enjoy doing them. We still do them on a daily basis. And pretty much all of our providers are performing them. We've got 300 providers within the medical group who are using the tool, and every single one of our specialties are able to perform virtual visits.
That's interesting. So it's not just seeing your regular doctor, primary care, actually specialists are doing some virtual visits as well.
Right, right. So you can do specialty visits, you can do acute visits. So those are things like a sprain or a strain, you know, cough, flu-like symptoms, COVID-like symptoms. We do those virtually. And then we also do our what we call chronic care and preventive care. So we can do our preventive visits to make sure you're keeping up with your health care, and then your chronic care management, things like diabetes, high blood pressure, and things like that. Do it all virtually and be able to maintain social distancing, be able to really help keep our patients and our associates safe.
And, you know, obviously you can't do surgery and injections and things like that virtually, but what are some of the things that can be done virtually that maybe people wouldn't necessarily think of as being able to be done through a computer?
Right. So we might not be able to do, like you said, surgery and things like that virtually, but we can certainly do a lot of the evaluations for things like that virtually. So, you know, things that are stable but might require a procedure, you could do that initial evaluation virtually and then follow up in the office, or vice versa. You could do that initial evaluation virtually and then follow up in the office. really there are very few limitations to being able to do virtual care. And if something, you're doing a virtual visit and you realize that it would be better suited for the office, and if we say, you know what, just go ahead and come on in so that we can finish this evaluation.
And it would seem like medicine refills and going over lab results or test results and even mental health issues and things where you don't actually have to pull out your stethoscope can be actually done virtually. Absolutely,
and those are really great opportunities to provide virtual care. And they're very efficient. It allows us to see our patients more frequently and in a more efficient manner.
What's the timing of virtual visits? Like when are they offered?
So currently, virtual visits are offered 7 days a week through Health First, and even into extended hours in the mornings and in the evenings. Pretty much, like I said, every provider is doing them, so you could always call your provider's office and do a visit virtually with them whatever time frames they're offering. Or if you had an acute concern like what we're talking about today with flu season and COVID, you could always call to have an acute visit as well, either with your provider, or we have an immediate access virtual clinic that you can call. The phone number there is 321-434-3131, and they provide care for those acute concerns very quickly if your primary provider isn't available.
Very good. Well, thank you very much. So we hope to see you at a virtual visit. Now let's talk about flu and COVID. Health First is caring for the community throughout this, obviously. One of the important things that all of us can do to limit our sicknesses during this time is get a flu shot. It's time to get your flu shot. I got mine last week. Dr. George is getting hers next week. September, October is the perfect timing for getting a flu shot. The CDC recommends everybody 6 months of age and older get a flu shot. We're going to talk about some myths out there, and we're going to try and give you some straight talk about getting yourself protected, getting your family protected this year. It's more important than ever this year to get the flu shot. COVID-19 is serious enough by itself, but trying to recover from influenza and then get COVID-19 would be very, very serious indeed. We're all hoping that this year's flu season is lighter than usual because of the physical distancing that people are doing and the masks and the hand washing, but there's no guarantee. Every year in America, 30,000 to 80,000 Americans die from influenza, 30 to 80,000. Just to put that in perspective, that's in the 6 or 7 month flu season. Just to put that in perspective, we lost 58,000 Americans in the 12 years of the Vietnam War. So we lose 30 to 80,000 just from influenza. Already in the last 7 months, we've lost 200,000 to COVID, just for perspective. Preventing flu, and every year around this time, our hospitals nationwide are busy, and preventing the numbers of influenza cases that make it into our hospitals will preserve resources too, preserve PPE and preserve personnel and resources so that they can care for the pandemic during this flu season. Can we get to some questions?
Yep,
okay.
Absolutely.
So let's go ahead and answer some questions from the community about influenza and coronavirus.
Great, so these are just several questions that we've been receiving from people just, like you said, wanting to know more and wanting to dispel some of the myths that are out there. So let's start with, when should people get their flu shot?
And so right now is actually the perfect time to get the flu shot. The guidelines recommend having it done in September, definitely by the end of October. However, should for some reason you not be able to get your flu shot right now, really you know, through the end of the season, we do still give them, but ideally we would like for you to have it done in September or October. It takes a couple weeks for that flu vaccine to kick in, so we really want to get the immune process started before the season peaks.
And who should and should not receive a flu shot?
The list of who should not get it is very, very small. If you've had some sort of horrible reaction or something in the past, talk to your doctor first. The vast majority of us should get it. You know, a lot of people who say they've had a reaction, you're going to get a sore arm, you're going to get a little achy potentially, you might get a low-grade fever. Remember, that's not the flu. The flu shot did not give you the flu. The flu shot may have made you a little achy, but the flu kills people. The flu is much more serious than that. And so generally, you know, side effects are pretty minimal. Even the egg allergy is pretty much gone. There was a time when if you were allergic to eggs, you shouldn't get the flu shot. Now that's no longer a recommendation by the CDC. And so generally everybody 6 months of age and older should get the flu shot. It's been more studied than almost anything. It's been proven to work, and the side effects are extremely minimal.
If you guys have a patient that says to you, why do I need to get vaccinated from the flu? What do you say to them?
There are a lot of things that, you know, directions that you could go with that question. I mean, like Dr. Laird was just saying, this is one of the most studied vaccines. It's been around for a long time. Every single year it gets better and better. And, you know, when we vaccinate against the flu, certainly that's what we're vaccinating for directly. But there are a lot of complications related to the flu that can be worse than the flu itself, and those are the things that could lead to death related to flu. So by preventing the flu, you're preventing those other processes from occurring.
Yeah, the other thing is, even if you are not getting the flu shot for yourself, get it for your kids, your parents, other people in the community that for whatever reason may not have been vaccinated or may be susceptible to the complications, even if you're healthy. You just don't want to spread it. You know, a lot of people say, well, I haven't gotten the flu shot and I still don't get the flu. And I tell them, yeah, you only have to wear your seatbelt on the day you're going to get in a crash. All the other days you don't really have to wear it, of course. But you don't know when that day is going to be, so you wear it every day. And that's the same reason I get my flu shot. Most of the years, sure, I probably would luck out. I wouldn't get the flu anyway. But I get it every year just to be prepared. And so that's how you think about it. You know, all the stories of, oh, I don't need it or I might not get the flu. And of course, every year around March or April, there's always a story out about how the flu shot only protected against certain strains that year. They can always see in retrospect. And of course, I mean, they don't always get it completely right. Usually it's 40 to 60% that it protected against the strains that circulated that year. But if you don't get the shot, you're at zero. So I'll take 40 to 60% over zero protection any day.
Absolutely. Is it safe? You know, this is the first year, obviously, that there's this COVID-19 pandemic, and so lots of people are asking, you know, is it also safe to get a flu shot while we're in the middle of this pandemic? How would you guys answer that to your patients?
Absolutely. It's definitely safe to get a flu shot during the pandemic, and probably even, you know, out of all of our flu seasons and, you know, throughout the years, this is probably one of the most important years that you could get the flu vaccine. Again, you know, there are thoughts that you can get the flu and you can get COVID at the same time, or you could get the flu and then get COVID afterwards. And, you know, both illnesses are just terrible. And so to be able to protect against one aspect of that is just so important this year.
And I know it's hard to sort of know this for sure, but, you know, what does happen if can you get the flu and COVID at the same time, and what does that look like? Do we have any idea?
Yeah, there have been reports of that exact thing happening, and you know, one would assume, since they are two totally separate viruses, that that's going to be a double whammy. And just as both diseases are extremely serious, I would expect, and you're right, it hasn't been totally studied because we're in our first flu season with COVID, but that the outcomes won't be good.
And what are the different, this is a good question too for people, you know, everybody obviously, you get a sniffle, you get a sore throat, oh no, is it COVID, is it the flu? So what are the differences between flu and COVID-19 symptoms? How do people self-monitor that?
The symptoms, almost every symptom with flu and COVID-19 overlap. So fever, headache, fatigue, sore throat, cough, congestion, shortness of breath, body aches, you know, they very much so overlap. The one major symptom that stands out that's different between COVID-19 and influenza is that loss of taste and smell, which is pretty consistent amongst our patients with COVID-19, whereas we don't really see that with influenza.
Yeah, it'll be difficult for doctors and patients to differentiate the two unless they have the loss of taste and smell, and so they may need to do testing to see which one it is. Having said that, the treatments are really quite similar. I mean, there is a drug called Tamiflu. If you have influenza, it's not the magic bullet that some people would hope. And of course, we don't really have great treatments for outpatients for coronavirus. So it's very difficult to tell the difference.
Some people were wondering if a flu vaccine would protect them against COVID-19.
No, the flu vaccine is protecting against the flu virus. It's not protecting against COVID-19. But certainly, you know, being able to avoid having the flu during this pandemic is just so important.
I've also heard the question about the pneumonia shot, whether the pneumonia shot would protect you, and it also wouldn't, because we call it the pneumonia shot, but really it's a germ against a specific strain of pneumonia called pneumococcus. And so each of these vaccines is against a particular organism and not really against the general disease overall. And so that's why the vaccine against the organism of flu doesn't protect you against the organism of coronavirus, and the same with pneumococcal. Even though flu and coronavirus both can cause a type of viral pneumonia, but that's different from the bacterial pneumonia that the vaccine you may have gotten protects you against.
This is another good one. You hear lots of people, I'm sure you've heard lots of patients saying that they got the flu shot and then they got the flu. What do you say? What do you guys say to that?
That's impossible. Okay. Well, I shouldn't say that. You could get a strain of the flu that wasn't covered in the vaccine. So that is possible. So if you so happened to get exposed to a different strain, but you certainly did, and so yes, just like I always bring it to automobiles, just like you can still get in a crash even though you're wearing your seatbelt. And so you can still get a different type of strain of the flu, but, and if you do get the flu even by a covered strain, your disease will be much more mitigated, much milder.
And there are different types of flu vaccines. Can you guys give us a little bit of insight into that?
Yeah, there are multiple different types of flu vaccines, but I think in this case, really the focus is on the regular flu vaccine or the high-dose flu vaccine. The high-dose flu vaccine is intended for our patients who are over 65 years old, and then everybody else gets the regular flu vaccine.
So is the thought behind the flu shot also that even if you were to get a different strain of it, would it be less severe potentially?
Right. You would hope. Now, I don't actually know how much a totally different strain would be mitigated from the shot, but in general, the disease is much more mitigated and much milder if you've been vaccinated. The other thing about this year's flu shot is, correct me if I'm wrong, but I believe all of the commonly available vaccines this year are quadrivalent. So they protect you against 4 different strains of influenza. In the past, many vaccines have just protected you against 3 strains. So that's an advance that's available this year.
And we touched on this just a little while ago, but why do some people not feel well after getting their seasonal flu shot?
Once you receive your flu vaccine, your body is going to create an immune response. It's going to start circulating your body's natural healing mechanism throughout your body, and that can cause some achiness, some fatigue, and stuff like that. But it's certainly not the flu, and it's certainly much less severe than if you were to get the flu itself. But so you might not feel great for a day or two. I have very few people who come in and tell me that anymore. I think every year as we know more about the virus and know more about the vaccine and do things to make the vaccine better, I think we see a lot less of those side effects, but it is possible.
I agree.
Okay. Is it too late to get your flu shot after Thanksgiving? I know we talked about that September, October timeframe, but as a physician, would you?
No, you can even get it in January, February. I mean, don't push it off that far on purpose, but if you just absolutely can't get it before the beginning of the year, still get it. It may protect you for the spring flu season.
In Florida, our flu season just lasts so long. So again, don't put it off, but don't not get it because it's November.
Right.
And how would you describe the protection that a flu vaccine gives people if they were to get sick? How does the protection? How does that sort of overall work on the body?
So your body produces antibodies against germs that it has encountered, and so when you have a killed germ deposited under the skin, your body goes to work learning about that vaccine so that it can then, or against that germ, so that then it can mount a more effective response weeks or months later when you do get exposed to that. So that's how vaccines work in general. It just produces antibodies. It's a way to strengthen your immune system. There's a lot of hype out there about different potions and things that you can do to strengthen your immune system. Plenty of rest, good healthy diet, yes, those things can help strengthen your immune system, but there's no better way to strengthen your immune system than by vaccination.
This is a good question. Should a flu vaccine be given to someone with suspected or confirmed COVID-19?
Now, in those cases, in general, if you're acutely ill, meaning if you're very sick, fever, just quite unwell, we would want you to wait until you pass that sick period and get your flu vaccine after that time frame. So you want to let your body work at treating what it's treating and then introduce the flu vaccine after that to be able to have your body help to mount that reaction afterwards.
And that's true with any sicknesses, right? I remember when my kids were smaller, if they were on the verge of sickness, you're supposed to wait to get the vaccine, right?
Yeah.
Yeah, like super minor illnesses, you can still get vaccinated. But yeah, if you're sick with COVID or something serious, you got a good fever, I'd wait.
As physicians, how much does this COVID-19 pandemic going on at the same time as flu season complicate things? Or there's been lots of talk also that people are being more vigilant, wearing masks in public. Is it just something that we have to sort of wait and see how it comes out? Yeah,
I definitely think that there's going to be a wait and see, period here, but you are 100% correct. In general, I don't know if there's any wood to knock on. In general, we're seeing a lot less acute illnesses, a lot less upper respiratory infections in the clinics. Keep wearing those masks. I know there's talk about, further opening services, but keep wearing those masks, keep washing your hands, keep using the hand sanitizer. It's only going to help to prevent other types of illnesses that are even unrelated to COVID-19.
Great advice. What steps are being taken, or is anything being done differently to safely administer flu vaccines during the COVID-19 pandemic? Sort of, how does this change?
Yeah, it's not. I mean, we're pretty much giving it the same way, with the exception of course, everybody's masked and we're keeping more distance than we have in the past, and the hand sanitizing and that sort of thing. Otherwise, the actual delivery of the vaccine is the same. Would you say?
Right, I agree. The other main thing I think that's different this year is that we have a lot less sick people coming into the offices. In general, with the medical group, we're trying to see all of those sick patients virtually. So we do our evaluation virtually to allow them, number one, to stay at home. They're not feeling well. They don't want to have to get out of bed and come to the office and sit in a waiting room. So it allows those sick patients to stay at home and take care of themselves, but also helps to keep the germs out of the building. So the patients who are wanting to come in to get their flu vaccine or other preventative services or just to continue their chronic care management, they're able to do that in, in a safer environment.
Tell us a little bit about your experience with virtual visits. It's something that's new for most people, and like you said, we've, bumped it up from 0 to 100 in no time. And tell us a little bit about just sort of like your experience and what patients are saying and how it's changed your job as a physician.
Yeah, my job is very different now than it was 6 months ago. I think all of our jobs are a lot different now than they were 6 months ago. But, on my side, the thing that I love the most about virtual visits is being able to get to know my patients in a different environment, in a different way than I've met them before. When my patients come into the office, they're seeing me in my environment. But when I get to go to their home with them or go to their workplace with them, or even I did a really neat visit recently with a patient who was out on a kayak, so that was really neat. But, I'm really getting to learn this other part of my patients that I wouldn't have gotten to know if they were just coming into the office.
Yeah, I've been impressed by the unexpected advantages of virtual visits. So, for example, the truck driver that's in Tallahassee that can't get in for their visit, they can actually get their diabetes visit and stuff done where they would have missed it. The kid at college who needs a med refilled, somebody who literally had something come up and couldn't leave work, and somebody who really wanted to accompany a sick parent to a visit but maybe lives out of state. And so you're seeing the parent locally, but the daughter from out of state can call in and be part of that visit.
Yeah, see you and see their parent and see that interaction and hear it firsthand.
And we've even had a few providers who were home on quarantine, but would normally not be able to see patients, but they're healthy, they're well, and so they could do a virtual visit.
Yeah.
So, there's been some kind of unexpected advantages of virtual visits for all involved.
Very interesting. And it sort of brought the future here sooner, right? I mean, because
it did.
That's something that, we were working toward, but then just sort of made that happen sooner. So just one more question then from my side, and then I'll let you guys share your final thoughts. Is it the same people at high risk for flu complications as COVID-19 complications? Is it those same groups of people that we're looking at that have the same risks?
It is. It's our vulnerable population. So with COVID, it's generally more so the elderly population, patients with comorbidities, so people who have underlying medical problems, high blood pressure, diabetes, different underlying medical conditions that make them at higher risk. And then in influenza, again, those same risks and, just our vulnerable population in general.
And it's really when you tabulate who has those things, if you add all the people in America who've got some sort of lung disease or lung condition, maybe a heart condition, maybe somebody who's fighting cancer, some child who's got a condition where maybe they're on medications that weaken the immune system, the diabetics, the hypertensive. I mean, it ends up almost every family, I would think, has somebody either with a condition or they themselves have it. And so the idea that this is just a disease for people in nursing homes or the super, super sick, I mean, it's extremely common that somebody close to you has a condition that could put them at higher risk for both influenza and coronavirus both.
So what are your final thoughts? What final advice do you have for people that are sitting home listening to this?
I would say, more so than ever, it's so important to keep up with these things. We've done so many different things within the medical group to keep you safe. So don't put off coming in to get your flu vaccine or other vaccines. Don't put off your care. Go ahead and, either be evaluated virtually or, if you need to come into the office, come into the office. It's safe to do that, and, and we're here for you to do that.
Yeah, I agree. Get the screens that you're due for, get the preventive tests you're due for. And then lastly, just realize that the virus doesn't play favorites. I mean, the virus is going to spread if you engage in the activities that allow it to spread. And so don't think that, you're just going to go to the store for a second or you're just going to, forget your mask, for when the virus doesn't care. It's going to spread. And so you really don't let your guard down. Keep protected, keep your family protected, and keep those loved ones around you who may have a predisposing condition. Keep them healthy by doing the right thing.
Now just keep in mind, I want to give that phone number again. That's 321-434-3131. So you can call that number to get set up with an appointment with your provider. You can call it to get set up with a virtual visit. You can call them so that they can get you set up to see your provider to do your flu vaccine. So just keep that number in mind. You have to remember one phone number for the medical group. That's a really good one to remember.
And if you have questions that we didn't get to or that you think of afterwards, just email them to questions@hf.org, questions@hf.org, and put COVID-19 and the flu in the subject line.
And then you can put you should be able to see on the screen, there's also a link there to the CDC website that has information about the flu and flu vaccine. So that's a really great resource. That's where I generally guide all my patients to go for information.
Well, we want to thank you guys for joining us tonight. Health First is here for you. We want to keep everybody in the Space Coast healthy, and thank you very much.
Thank you.